लैपटॉप अभी आ गया ना, अभी
Good evening, everyone. At the outset, let me first welcome everyone who has come here today in this COVID time where nobody is able to come. So first, I welcome our director, Professor Guleria, sir, who kindly consented and agreed to come here at this point of time. And then Dr. Vik, sir, who is here with us. And then all the dignitaries who have joined online, Professor M.V. Padma, Chief Neurosciences and HOD Neurology, and Mrs. Geeta Narayan, who is Joint Secretary, DHR, ICMR, Dr. Anurag Agrawal, Director, CSIR, IIJIB. Unfortunately, Dr. Kamlesh Tiwari has not been able to join. He is President to Association of Physicians of India. Then Dr. Nirmal Surya, who is President, Indian Academy of Neurology, has joined here. Dr. Rajesh Gokhale, Secretary, DBT, who is with us. So I welcome all the dignitaries present here and also welcome Dr. D.K. Sharma, who is our superintendent, and Dr. Subrata Sinha, who is our Dean Research, and Dr. Sharif, who is here with us, who is in charge of telemedicine facility, and also Dr. Lalwani, who is registrar. Thank you, everyone. In the beginning, I would like to tell a little bit about why this book. It is somewhere in March and April when the first wave was almost fading and second wave was starting and a new posting was being started. And as you know, that Professor Vig, who is here, chairman of COVID Task Force, again gave us the responsibility of looking into new private ward and all those areas. So at that time, we were already getting cases who were having post-COVID complications, post-COVID symptoms, several post-COVID things. So we thought there is no authentic literature on this particular subject. So we should come out with something on post-COVID. And also, I was peculiarly placed at a position where so many people of different departments were there, from cardiology to nephrology to everyone, to ophthalmology to dental, everyone was there. So I thought that I should come out with something which has everything into it. Everything post-COVID, not COVID, post-COVID rather. So I will invite Dr. Arvind, who will tell in brief about the content. And also, before Dr. Arvind does that, I'll request Swasti and where is the other one? Smil, to welcome our guests who are physically present here. Dr. Guleria sir and Dr. Vig with the plant. Please present the plant. Thank you, sir. Now invite Dr. Arvind to tell in brief about the content of the book. Thank you.
Good evening, everyone present here. Respected Director Professor Guleria, sir. Respected Dean Academic Professor Sinha, sir. MS, sir. And Chairperson COVID Task Force, Professor Naveed, sir. All the dignitaries who are here in this hall and those who are attending this from online mode, and my dear residents. We've gathered here for a work done mostly by residents and faculties of different departments of AIIMS New Delhi, because considering the enormous number of COVID cases that we have seen over the last few years, post-COVID clinical issues are going to be immense. And as we have seen, it is debilitating and it is long-lasting. But realizing that amidst all the surges, the acute infection, the acute severity and its treatment has gained most of our attention. The discussions has been always on those mostly. So realizing the importance of post-COVID clinical issues by members of COVID task force, we all gathered together and have tried to correlate all the available evidences as well as our growing experiences in this field in form of this book titled as Post-COVID Clinical Issues and Their Management. Summarizing the content of this book gives a very crisp, system-wise approach, which is written by specialists from almost all the clinical departments of AIIMS New Delhi, like Department of General Medicine, Department of Family Medicine, Department of Hematology, Geriatric Medicine, Rheumatology, Department of PMR, Gynecology, Hematology, Forensic Medicine, Pediatrics, and other clinical departments. Besides these special systems, there are a few chapters which will gain importance and concerns from various departments like post-COVID infections, neurological aspects, yoga, how to prepare a hospital for a pandemic, which we have gained, which we have learned after this pandemic, and we have grown with each and every surge of this wave of this pandemic. So I genuinely feel that the coverage of this book is immense, it is vast, and it would interest all the targeted readers, the primary care physicians, the subspecialties, and also those who are keen to get rid of the myths which are there in the society, general public, the patients. So with this brief comment, this is an attempt that all of us are on the same page as far as the optimal patient care of post-clinical issues managements are concerned. So for further proceeding, I'd like to hand it over to Professor Achal, sir. Thank you very much.
Thank you, Dr. Arvind, for giving brief description of the book. Now I'll request Professor Naveed Vig to say a few words, who is currently chairman of COVID Task Force and heading the Department of Medicine. And he has interest in the field of infections and immunology and has been rightly placed in chairman COVID Task Force. And the people will not believe, I know him from last 25 years. I've worked with him as a junior senior resident. Thank you so much.
Thank you, Dr. Achal. I would like to compliment both Dr. Achal and Dr. Arvind, because the way they have come up with the book and so fast. And this actually represents the soul of COVID Task Force. So what was COVID Task Force? It was made by Professor Guleria, who is rightly there as director, as internist, as pulmonologist, much more, and a good human being as well. So I'm not giving you much respect, but that's what I'm trying to tell you, that you have to give freedom to work, you have to execute it, and that is the teamwork. So this soul of COVID Task Force was the teamwork. The way hospital administration under like Professor D.K. Sharma, the way their department handled all facilities, the way all departments handled everything. So it was unbelievable. This surge was inevitable, whether it was first wave, whether it was second wave, whether it was third wave. Fortunately, third wave, we are getting less patients, so we are better off, but we don't know currently. Our beds may be full very fast. But we had two aims in with this. And the whole credit for all this work goes to our residents who did brainstorming. They did not mince words. They spoke whatever was right. They did whatever was needed to be done. They came up with all evidences. They came up with all infection control practices. They came up with donning, doffing. They visited all facilities. They made all these facilities. So once donning, doffing was done, hospital infection control was there, treatment guidelines were made. And everybody was working independently. And then we had this meeting every day, which was led by Professor Guleria, where the whole institute participated, all nurses, all technicians, all staff, they were there every day. So this happened over months. This happened over years. Today, we are still not clear about many things. And that is where this book is. This book is collation of experience. Dr. Achal and Dr. Arvind, they looked after EHS patients. Our first aim was to take care of our health employees. Then second aim was that AIIMS should be able to give the best care. So we had some communication gaps, but our soul was pure that we will deliver and we will deliver collectively. So that is why this book is vast experience. This is a lot of experience from all departments, whether it is neurology, whether it is cardiology, whether it is dermatology, whether it is eye, whether it is ENT, whether it is forensic. So it is all departments, including hospital administration. So this is the soul, and I compliment them and I congratulate them and all the authors and the editors. Thank you very much.
Thank you, sir. Now I request Professor M. Padmanabhan to say a few words, who is currently Chief of Neurosciences Center and Head of the Department of Neurology. And I personally owe her many things, and she has been my teacher. Now I request her to say a few words.
Thank you, Achal. Good evening, Professor Guleria, our Honorable Director of Institute, and all the dignitaries out there in the boardroom and also online. I wish I was there in person, but Naveed would kick me out because I'm fifth day post-COVID. And I did join the office, but against his wishes. So I couldn't take the chance of meeting him in person. So that's why I'm online. Apologies. Now, I guess it's courage under fire. That's how I describe this whole venture. The pandemic has been a real roller coaster ride. I guess unprecedented challenges bringing us to this. I think the existential crisis and maneuvering these rights and then trying to exist, ensure survival for ourselves, for others, for the universe in general. And then beyond that, we see these innovations, the ignition of these sparks of brilliance. We've seen this emanating out of this crisis. But beyond the call of duty, all of us as professionals, we were doing our work. As a neurologist, we were seeing patients. And I see these two young guns, Dr. Rachel, Dr. Arvind, so they were seeing patients. And then when we went home, then we would unwind. And these guys went home and thought about writing a book. So that's what I mean to say is that bringing about an idea and then bringing it to the fruition and doing it in records time, as Dr. Naveed had said. and bringing about a very, you know, a quintessential aspect of a COVID care, which is not often talked about, though there's a lot of research out there, and especially the spectrum, the whole panorama of post COVID, which is mind boggling. We still don't have answers, and they're trying to get out those things which are not just brought out of literature, which is published, but actually hands on experience. And that makes it special, a really special phenomena. And that's the reason I really describe this as courage under fire, because that's, I guess, that's a birth of uh, an iconic venture out of a crisis. And sometimes, a lot of times, I do feel like a mother hen, very proud, and Achal has been like a little brother, and I've seen him grow into this huge, amazing personality. I'm so proud, and it is true that a real special, it's just not beyond congratulations. It's a heartfelt gratitude for what you both have done, and God bless you. And just a thought, as a passing remark before I sign off, is this is long COVID. What you've done is post Delta. I only hope you don't have an Omicron as a long something. Hopefully not. So this is something which probably we need to look at. Naveed, maybe you need to take charge of that as well, and I'll be the first one to volunteer here. And so that was a lighter note. See, all the best. God bless, and bye bye.
Thank you, ma'am. Now I request Mrs. Geeta Narayan, Joint Secretary, DHR ICMR, to say a few words. In one word, if you ask me, I'll say somebody, no adjectives, very simple lady. Dr. Geeta.
Good evening. Good evening, sir. And I feel very honored among all the dignitaries to participate in the launch of this book, this special book. And ma'am Padma, Dr. Padma has already said a lot about it, but I feel that as a non-doctor, I'm in the administration. So this COVID-19 pandemic has like captured the collective and individual mind space of all of us and across all the countries. And it is in this context that this subject is the most topical and relatable. It would certainly allay many anxieties that arise from the fear of the unknown by providing insight into these emerging complications to all the stakeholders, including doctors, patients, public, and the researchers as well. That's what I feel. Another important aspect that I feel about this book is that it is based on available evidences and experiences of the faculty of the AIIMS, like the AIIMS, and that really elicits more trust in the findings. It is also rare to find that such collective efforts are made for the benefit of the society, where like all the contributors have not bothered about whether their names are coming or not coming. They have contributed to it. And so kudos to all the contributors, and especially to Dr. Achal and Dr. Arvind for spearheading this project. All the best. Thank you so much for inviting
He's very closely known to me for many years. He is closely known to me for many years. I think maybe around 20 years. And as I said, he is a physician scientist, and he has done a lot of work in the field of pulmonology. And now I invite him to deliver his address.
Thank you very much, Achal. It's interesting that both of us are members of both organizations that we are at some point in time. Your stint at IGIB is very well known to us, and I have been at AIIMS previously in a different life. It's very important. It's very good. Geeta ji said it. The AIIMS, which everybody looks up to for evidence, for guidance. And what is very unique that I've always been able to see about Achal is his ability, whether technology or medicine, to see the most important problem down the line. Deaths, hospitalizations will pass. We will get over them. But the long-term effects of the billions of people infected are going to be a major problem. We know very little. And that is where we needed evidence the most. That's where we need to think a lot. And Padma put it right. We have yet to find out what's going to happen with Omicron. This is about Delta. But again, it's going to be the same process of painstaking evidence collection, guidance, and continuance. I look forward to further such efforts, and I'm really glad that you and your colleagues and everybody at AIIMS got together to make this effort. Thank you so much.
Thank you, Dr. Anurag. Next in the list was actually Dr. Kamlesh Tiwari, who is President, Association of Physicians of India. Unfortunately, he could not join because right now he is also having a meeting of API. So he could not join, and he has sent his blessings. Thank you, Dr. Kamlesh. And I would like now to invite Dr. Nirmal Surya, who is current President of Indian Academy of Neurology and a very close friend of mine, although he's much older to me, but I do call him friend. I take liberty to call him friend. And also, he is a chairman of Epilepsy Foundation and as well as Surya Neurosciences Center. He currently works at Bombay Hospital. So I request him to say a few words. Thank you, Dr. Surya.
Thank you, Achal. Respected Dr. Guleria, Professor M.B. Padma, my colleagues at Neurology and IAN, and all the dignitaries who are here. We are still in the COVID time. We're talking about the COVID. Some of us are suffering from COVID, treating the COVID. And during this, Achal and Arvind has brought a book on the post-COVID clinical issues and management. What better it could have been. I'm sure it covers a wide range of chapters, and there are about 25 chapters I've gone through, including the neurological, of course, and pulmonology, rheumatology, ophthalmology, and all the other parts. So I think it gives a comprehensive overview of how the COVID affects the human body. And I'm sure it will be useful for not only physician and general practitioner, but also for the society. And this is a wonderful effort. And I'm sure during the COVID time, with AIIMS being at the helm of the #1 institute in India, where most of the patients were coming and all the guidelines under Professor Guleria were coming, I'm sure you all were busy, but yet you could come out with such a document. So it's a great work. Congratulations to all of you again. And I'm sure this won't be the last book. I'm sure you would come out, as Padma has already mentioned, something in future on Omnicure. So my best wishes, and thank you very much for inviting me for this important program.
Thank you, sir. So now I invite Professor Gokhale, Professor Rajesh Gokhale, whom I know for more than 12 years and have worked with him in various subjects, I will say. And he is a renowned immunologist and Shanti Swarup Bhatnagar awardee, and also received National Bioscience Award. Now I invite him to say a few words. Dr. Rajesh Gokhale.
Thank you very much, Dr. Achal. And thank you also, Dr. Arvind Kumar, for inviting me. Thank you, Professor Guleria, for speaking at the end, because otherwise I wouldn't have left it to say anything more important than what all of you have said so very wonderfully. But I just thought there are a couple of points that I've learned from COVID, which is always very, very interesting, actually. It's probably changing the way, having worked for infectious disease biology for all these years, the disease severity was always thought to be a direct function of pathogen burden and in an infectious disease. And the clinical focus used to be how to efficiently clear a pathogen, actually, right? I mean, if you work with TB, you say, get rid of the TB, actually. In fact, the host response and the infection was never so critical. In fact, what this book is all about is post-COVID, actually, right? So it's really post the pathogen. And this will change the whole biology and the clinical setup of the way things will come, actually. And I think you have done such a fantastic job. Of course, Professor Guleria has always, worked on this area in variety of ways, actually. But I think you people have done fantastic stuff, actually. I just want to take an example from, I was just thinking about, COVID yesterday. We said something. So, I just thought about this Avengers Endgame. I don't know if you've seen this movie, Hollywood movie, Avengers Endgame. There was this Thanos who was like a COVID, actually, and he was intergalactic warlord, disintegrates the half of the world already taken away. And then you're left with fight with an evil, and this task is very daunting. And what was done is that many heroes got together in that movie to get rid of Thanos, actually. And in fact, this book is all about that. I think you put together this wonderful team of people together, rather than using Bollywood egocentric single heroes who kill everybody without doing things by yourself. So I think you've done a fantastic job, and I must congratulate you and all the other contributors for doing this wonderful work. It's really, really very, very relevant, and thank you very much. And as you said, I've known you since IGIB days. It's fantastic to see this wonderful thing coming. Thank you very much again.
Thank you, Dr. Gokhale. Now, I invite our director, Professor Randeep Guleria. So, whatever I speak, it will be short. So, there is no need to introduce him. So, I request him to say a few words. Thank you, sir.
Thank you, Achal. Dr. Gokhale, Secretary DBT, Dr. Nirmal Surya, President, Indian Academy of Neurology, Anurag Agarwal, Director, CSIR, who is actually, I think, more AIIMS than CSIR from my point of view. Ms. Geeta Narayan, Joint Secretary, DHR, ICMR, Dr. DK Sharma, Dr. Subhatra Sinha, Dr. Lalwani, Dr. Padma, Dr. Naveed Vig, my other faculty colleagues, students, ladies and gentlemen. First of all, at the onset, let me really congratulate Dr. Achal and Dr. Arvind for this really thought-provoking and very good book on post-COVID clinical issues and management. If you look at COVID, I think COVID has been the biggest challenge of the century, and in my mind, probably the biggest challenge AIIMS has faced in its existence. We had to really do so many things which we had never imagined that we would do. And whether it be the challenge to clinicians, they had to rethink their management strategies and reappropriate spaces. I remember Dr. Padma having this huge panic attack when a patient with stroke turned out to be COVID positive, and then they started realizing that COVID can also cause stroke, and it has extrapulmonary manifestation, and the patient had got a CT, MRI, even intervention done, and then turned out to be COVID positive. So it really threw a lot of challenges to clinicians. It threw challenges to hospital administrators. How do we reappropriate things in terms of the number of cases that you see, and how do you balance COVID and non-COVID and really provide optimum care? Through challenges to researchers, what is new and what else do we need to find out? How can we do cutting edge research while we're fighting a pandemic? That was another challenge that was there. And of course, to labs, how can they scale up the testing? We started off with very few labs being able to do an RT-PCR test. And over months, years, developed new techniques. CVNAT came in, the lateral flow, the rapid antigen test. So a lot of things that labs had to do also came up. And I think this is something that has been a great learning for all of us. But I'm very happy that they've really come out with something which is beyond COVID, the post-COVID, because I think this is going to be a major medical challenge in the coming decades as far as patient care is concerned. It's also interesting that post-COVID is a disease or syndrome, if I may put it, which was first described by patients rather than the doctors themselves. Patients got together on social media, on Facebook, and started describing problems that they were facing. While the doctors felt that now you've become all right from COVID, you go home and that's it. They started connecting with each other and realized that many of them were having similar problems. And that's how the whole story of long COVID, or the long haulers, as it was at that time known as, started. When we started learning more and more. But I think we still have a long way to go. We still don't have a clear definition of what is long COVID. post-COVID. We don't even know how frequent it is. What is the prevalence? Some studies suggest that 1 in 3 of every person who recovers from COVID will actually have post-COVID. That's a huge number in terms of what we will need to do in the coming years. And then, of course, there's the whole issue of the presentation. The presentation is so varied and in so many systems, and that's why this book is very important, because it tries to cover all dimensions of the post-COVID sort of effects. I remember patients who recover and then come back with fever and develop cutaneous vasculitis. And the CRP goes up, and you're wondering what to do. You give them a short course of steroids, the vasculitis disappears, the CRP comes down, and if they're having fever, that becomes all right. Now what is the mechanism for this? How does it happen? Then there are patients who continue to complain of palpitations, pulse 110 to 120, detailed cardiac evaluation, everything is normal. What is the cause of their ongoing tachycardia? That is not clear. You obviously have issues like chronic fatigue syndrome, brain fog, and then patients who come with chest tightness. In our clinic, we see many patients who just say that they have this feeling that there is a weight lying on their chest and they're not able to breathe properly. What is the mechanism? The lung function is normal, CT scan is all right. It's very, very difficult. And I think that is the challenge that we have. I think there is a need that we should really look at long COVID as a challenge, not only from the point of view of what it is today, but what it will be in the future. And here we have issues of, looking at what is the prevalence of long COVID, who are at the risk for long COVID, what is the risk factors. I don't think we have an idea of what are the risk factors. One of the risk factors people have argued is those who have more severe disease. It's been argued that women have more long COVID than men, and it's more common in the middle age group. But do we have enough data for that? Why does long COVID happen? What is the pathophysiology? Various theories. Some people argue that virus particles still stay on in the body and they cause some sort of a reaction which leads to long COVID. Others have argued that this is total dysregulation of the immune system which the virus causes, and this continues for a long time. But I think we still need to do a lot of research in this as to find out what is the pathophysiology of long COVID. And in my mind, probably long COVID is not one disease. It's a syndrome of many illnesses. It involves so many organs that it's difficult to put it into one basket. And that probably will evolve over a period of time. And I would really urge the group which has written the book that they should also look at it from the point of view, what can we do to provide better care for our patients? We really have no idea what should be the treatment that we should give. What should be the treatment for patients who come with brain fog? Patients who complain of tachycardia, should we give them beta blockers or should we give them some drugs to decrease their heart rate? What about those who have other features of, like I said, vasculitis? Do they need to have long-term low-dose steroids? Or should we give some other immunomodulators? There's really no clear answers to all of this. So we need to really develop and have a consortium, in my mind, to look at what should be the ideal treatment strategies for various syndromes of long COVID. Similarly, there is a lot of other areas of research that we need to look at. I mentioned pathophysiology. There was some data which suggested that if you are having long COVID and if you get vaccinated, then your symptoms may come down. Is that true or not? I'm not sure, but again, it's an area of research. So I think as we talk of long COVID and as Achal and Arvind have managed to get together a group of clinicians who have looked at it from a multi-dimensional point of view, I would suggest that they should continue and form a group and develop new areas of research in this area of long COVID and really come out with treatment strategies, areas of pathophysiology, and in each specialty, what can be done to manage these patients. This is going to be the challenge in the coming few years. I'm pretty sure of that. And as Padma and Anurag said, what is Omicron going to do? Is it going to create a different type of long COVID? I'm not sure. The virus is really evolving and behaving, so it's difficult to predict. But these are, I think, issues that we need to look at. And AIIMS is one institute where all of this can be done. We have clinicians who are very much into research. We have very good research facilities, basic science research facilities. And I think this is the opportunity that we should work towards finding solutions for long COVID. And that will really help in what this book is all about. So congratulations for the book. And as has been said, hopefully others to come, maybe the book can also address issues which need to be answered and develop strategies for that. That would also be something which would be very, very useful. So at the end, I'd just like to take this opportunity to really congratulate all the authors, Dr. Arvind, Dr. Achal, but all the authors who have written chapters for the work that they've done despite their very, very busy schedule. It's very difficult to take time out and then write a book while you're having all these other issues as far as COVID is concerned. So congratulations to all of them. Thank you.
Thank you, sir. Achal, one small thing. Dr. Padma, nothing is going to happen to you. Everything will be fine.
So this is officially.
I've already joined. I have joined back, but I didn't come to.
I am saying there will be nothing like post-COVID with you.
Okay, thank you.
Most of you must have received the book with you online. So whosoever have received can release from there itself. Yeah. Thank you. Thank you, sir. Yes. हाँ अरविंद तू तो हो सर इधर आ जाओ भाई तो आगे खड़ा करो, पीछे दिखेगा ही नहीं वो। इधर आ जाओ। उसने भी लिखा है। हाँ तभी तो कह रहा हूँ। Thank you. Congratulations. Thank you, sir. Thank you. Sir. Okay. So I would like to thank everyone again. One thing I made sure was that there has to be one resident amongst the authors in each chapter. So that's how it happened. There is one resident at least in every chapter. Am I right, Arvind? Yes. So now I request one of the resident, Dr. Nikesh, to say a word of thanks. Thank you. Yeah.
So thank you, sir, for inviting me for vote of thanks. So on the behalf of the COVID task force and contributor of this, I would like to thank our director, sir, Professor Randeep Guleria, sir, and Professor Naveed Vik, sir, for showing us the path since beginning of the pandemic. I would also like to thank all the authors for sparing the valuable time for their contribution in this book. I would also like to thank each and every member of this task force from various departments for showing a commendable team effort during this pandemic and also for sharing the valuable experience through the various means. I would like to thank our computer telemedicine facility and Dr. Sharif for making online arrangement for our dignitaries. And at last, a special mention to the technical staff and to the horticulture staff for their contribution in today's event. And since every book needs a publisher, so at last but not least, I would like to thank the CBS publishers, especially Mr. Satish Jain, Mr. Arora, and Dr. Anju Dhir for giving our work a beautiful shape. Thank you all for attending. Thank you.
CBS Publishers is well known to everyone who has read anatomy, the book Chaurasia. So that is from CBS Publishers. So Thank you, everyone. And this is the end of the meeting, today's meeting. And I thank again everyone who has come today in today's meeting. And I thank all those who are online present here, Dr. Padma, Dr. Nima Surya, Dr. Anurag, Geeta ji, and also Dr. Gokhale. I think he just left. Yeah. Thank you, sir. Thank you, Dr. Guleria, sir, and thank you, Dr. Beg. And also thank other dignitaries, Dr. D.K. Sharma, sir, and Dr. Subhat Sinha, sir, Dr. Sharif, sir, and our registrar, Lalwani. Thank you so much. And also, many of the lead authors are here. And I think I would like to have a big clap for all of them who have contributed to the chapter. Thank you so much. Thank you.
Thank you, everyone. Bye-bye.
Padma, take care of yourself, please.